I don't like to just talk on the phone whenever I get a referral from a client. I typically spend about 40 to 50 minutes on a Zoom call going over the pros and cons, features and exclusions of particular health insurance companies. Here's a 55-minute Zoom call sample. If you have questions, just shoot me a DM. So usually when I talk to people for the first time on a Zoom call, I just ask them straight up, like, what do you want? What are you looking for? What concerns you? And usually these are the top concerns: low deductible, low premium, large network access of top doctors and hospitals. Did that kind of fall
Okay.
in line with what concerns you as far as health insurance goes?
Yeah, I would say so.
Any
This
other
would be my
concerns?
not really. This is like my first time doing anything with insurance. I haven't
Okay.
had insurance since I was in middle school.
How old are you right now?
Um,
22. So why do you need health insurance?
I kind of need more dental than anything.
When was the last time you had a dental checkup?
Probably a couple of years, maybe 3 years ago.
So you think you need like a filling, extraction, or some type of surgical root canal, something really big like that?
Maybe, possibly, yeah. I fairly take care of myself pretty good. Just I know I have some cavities that probably need to get filled.
We'll look at dental options as well.
Okay.
But do you have any other concerns besides dental, like maybe prescription coverage or therapy coverage?
No.
Not really. Okay. So as I mentioned earlier, prices are based on the four factors: your age, your zip code, your smoker status, your household income. I don't affect the pricing at all. You could simply just go on healthcare.gov or get covered Illinois or insure.com, whatever website. You just plug in these four factors and it's just gonna spit out the same premium that I would be sharing with you in this Zoom call. But the
Okay.
difference is that because I'm in the picture, I can tell you which options suck and which options suck the least. Have you had a chance to look around at all, see how much things cost out there?
I did last summer,
Mhm.
and I think I went through it through the wrong channels, and I ended up getting charged like 3 times in 1 month. So
Oh crap. Did you deal with like a agent or just bought it out on your own?
I was really just looking to see what I could do for myself. And next thing I know, I was on the phone with somebody, and I was getting like not full coverage. I can't
Okay.
really remember, but I just remember I was through a whole insurance, but then they charged me 3 times. So I did everything in my power to get rid of that, and I did. But yeah, I think it was just like a scam, to be honest, because they charged me like $150 3 times in 1 month.
Okay. Did you just deal with somebody over the phone?
Yeah,
Okay. Some workers do that. They just talk to people over the phone. I kind of don't do that. I'm a visual guy. And
yeah.
so you're going to see backstage as far as the application process goes in this Zoom call. But
Okay.
yeah, these are the four factors that dictate your pricing. All right. You have two different markets that you can go through. Okay. You can go to the Obamacare market or you could go to the Workers Association group health market. Are
Okay.
you familiar with the differences between the two?
It's not really. Not really.
Okay. All good. So you don't have to take notes. I'm going to email you all of these screenshots. Okay.
Okay.
I'm going to hide some rows here just so that you're not overwhelmed with information here.
Okay.
Okay. So like I said, you got two markets. You could go to the ACA route or the Workers Association Group Health Insurance market route. Okay. Now,
Okay.
when you shop around for health insurance, like you did last time, did you just Google the word health insurance?
Basically, yeah.
Yeah. So what happens is like when you Google the word health insurance, you're sent to like all these different, let's say Google, and you type in the word health insurance. You see all these links right here. These are sponsored results. One, two, three, four. Those are like soliciting websites. They're not really health insurance companies. Like
Yeah.
healthcare.gov, it's a search engine, Blue Cross Blue Shield, United Healthcare. These are the actual health insurance companies. But these
Okay.
four links, like if you click on it and then you disclose like your zip code, and then you click on continue, you click on individual, and then select an age group. Let's say you're 20, you're like 22-ish. But let's say your income is
Yeah.
around 20, 60,000. You put in all this information in the bottom of the footnotes, it says right here that an agent will contact you with additional information. So you're gonna get like bombarded with health insurance quotes for like the next 3 to 6 months. That's probably what happened
Yeah.
to you. So watch out then the next time. Because that's what happened to
Okay.
me 13 years ago. I Googled the word health insurance myself. I plugged in all my numbers and then Dude, everybody kept calling me for like the next 6 months. But when you're shopping around out there, whether it's Blue Cross Blue Shield, Humana, Aetna, Cigna, United Healthcare, these are the usual suspects. Are you kind of familiar with them?
Okay.
The name brand of a health insurance company in this day and age doesn't matter at all. What really
Okay.
matters is how the doctors and the hospitals get paid. So as much as possible, try to consider a PPO. And a distant second place is going to be an HMO. Are you familiar with the difference between PPOs and HMOs?
No, I'm not.
Okay, cool. Yeah, I didn't even know what a deductible was when I was 29 years old, and you're 22. So you're like 7 years ahead of me. And I just talk about this all day long. So just understand that like HMOs suck. PPOs are better. All right.
Yeah.
And HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. It's okay if you forget it, but just
Okay.
understand that HMOs are typically cheaper because you have a small network access of the very best doctors and hospitals. Whereas a PPO is larger because you have access to most doctors and hospitals. You don't have access to all of them because there are some
Yeah.
celebrity doctors that only accept like athletes and celebrities. PPOs are typically better. And the second reason is why you don't need a doctor's blessing for a referral. Because let's say you have a foot issue, you want to see a podiatrist. If you had an HMO plan, you would have to go to your PCP, which stands for primary care physician. You have to ask your main doctor for approval to go see that foot doctor, that podiatrist. And that could take days or weeks, which is why most people try to avoid HMOs, even though they're cheaper. Whereas a PPO, you don't need a doctor's blessing. You could just Google top podiatrists in Illinois, and then you can go see them next Friday if they're available. Does that make sense?
Yeah.
So back to this sticky note here. Third place and fourth place is going to be tied with like a HMO and a POS. So, and then second place should be an EPO. But I wanted you to understand what a PPO and HMO is. Okay.
Yeah.
Fifth place is going to be Medicaid. Have you ever heard of Medicaid?
Yeah, I think that's what I was on for the longest time. I've had Medicaid talked around me before.
Yeah, Medicaid, it got its pros and cons. Okay. It's zero cost, almost free, but it's also zero access from the very best like doctors and hospitals if a catastrophic scenario happened to you.
Oh, okay.
Okay, but it's solid when it comes to like your annual doctor visits, annual blood work, cholesterol screenings, that sort. But I don't think you've ever gone through like a catastrophic scenario with a Medicaid plan.
Yeah.
It could be limited. All right. Don't confuse Medicaid with like Medicare. That's like for 65-year-olds and older.
Yeah,
So,
okay.
and then there's also like a POS too. I'm just being technical here. POS means point of service, not piece of salami, but it is a piece of salami. But in the group health insurance space, there is a POS too with the Aetna plans. But that's besides the point. You are an individual market. So when you talk to like friends and family or colleagues, and they might give you an opinion, like they'll try to tell you like try to go through Blue Cross Blue Shield, or some other party might say avoid Blue Cross Blue Shield, they suck. Whatever their subjective opinion is, it's just subjective. All right. So Blue Cross Blue Shield, they have like a portfolio spectrum ranging from really, really crappy products to really, really strong products. So Blue Cross Blue Shield offers at least 15 different network variations. And guess who else offers the same amount? It's going to be the same. Humana, Aetna, Cigna, United Healthcare. They all have like a portfolio of different product lines. So it's like pointless for you to go to like reddit.com or just look at reviews and just say, how is Blue Cross Blue Shield? Like all of these, consumers, they just have like a very subjective opinion of that because there's so many different product lines. What kind of car model brand do you drive? A Toyota, a Mercedes?
A Chevy Equinox 2015.
So you have a Chevy Equinox, right? What do you think is like the top of the line model of a Chevy brand? Is it like a Chevy Tahoe or whatever?
Yeah, I'd say Chevy Tahoe.
Yeah. So there's a Chevy Tahoe, and then there's the bottom tier. I'm not familiar with the most entry base level entry model line for Chevy, but that's what I'm trying to give you a metaphor of. within within the health insurance space. There's so many different models of health insurance plans is what I'm trying to get at. You follow?
Oh, okay. Yeah. So they all offer different plans from being kind of lower on the end and then to the higher end. Is that what
Exactly.
you're saying? Okay.
Exactly what I'm saying. So that's what I'm saying. Like, don't try to be influenced so heavily on what other people's opinions are when it comes to all these different health insurance plans, because it's not a reflection of the entire brand. So, like I said, Blue Cross Blue Shield, if you look at my camera, they have a portfolio spectrum of ranging from really, really shitty plans to really, really strong plans. What I can tell you is the amount of denial rates within the insurance industry. Okay, the industry average is about 16% denial rate. United Healthcare, they have the most money. Want to know why? Because they decline them all. They decline 32% of the incoming medical claims. So for every like 1,000 medical claims that they receive from their paying customers, United Healthcare is going to decline about 320 of them. So did you hear in the news about that United Healthcare CEO that just got assassinated or just shot on the sidewalk?
Yeah.
Yeah, there's the personal reasons for that. Because the
Luigi
killer,
guy.
there's personal reasons for that. Because he wanted to be a martyr and try to lead an example of like, you can't mess with us, because he was burned by United Healthcare. Either him or like
Okay.
some personal family member or friend was pretty much mistreated when it comes to medical claims. I forget the story on that, but that's why he got shot.
Yeah, he took it out on him.
And so the industry average is 16%. You mentioned earlier that health insurance is a scam. In a way, it's 16% a scam, because people that buy health insurance, they don't know the pros and cons, they don't know the exclusions and everything. And that's partly by fault by the health insurance agent that you were dealing with over the phone. So virtually all health insurance agents are 100% commission. They just talk on the phone, and every health insurance company pays them differently. So if you're brand new and they just talk over the phone, they're going to want to try to pitch you like the most highest commissionable product, highest health insurance company.
Okay.
So that's why the industry is a little bit tainted in a way.
Okay.
You don't have like a omniscient point of view as far as like which one really sucked and which one is really good. But nonetheless, Blue
Yeah.
Cross Blue Shield is at 17% and then just ranges as high as 30% denial rates. That's what I will tell you. All right.
Okay.
So back to this side-by-side comparison with my sticky notes here. Do you have to be somewhere like at noon? Do you have a client or someone
Oh
to see?
no,
You're
no.
respectfully-
I'm at the barn. We're all good. I got time.
Oh shit, you're on a roof and I'm talking to you about health insurance? Jesus Christ.
Just give me 1 second. Yeah. Let me get down. Full focus. There you are. Okay. Be right
I have
there.
never, in 13 years of doing this, I have never talked to somebody while on a Zoom call while the person was on the roof.
I don't know if you can see me, but yeah.
Yeah, I could see you. All right,
Give me 1 second.
take your time.
Okay. All right. Got my full undivided.
Okay, good. All right, can you put a landscape just so that you can see better?
Yeah.
All right, so here's the main difference between the left side and the right side. So again, your two markets that you can go through are the ACA market, which stands for Affordable Care Act. That also means Obamacare. And then the
Okay.
right side is called the Workers Association Group Health Insurance Market. I'll dive deeper on that in a bit, but I just want you to understand conceptually the difference between both sides. So the left side is, again, Obamacare or ACA. It's also got other names, right? It's also called major medical, individual market, get covered illinois.gov if you live in Illinois. It's healthcare.gov if you live outside of Illinois. It's also called PPHCS, Patient Protection and Affordable Care Act. It all means the same damn thing, right? So if your mom or your boss says you should go get insurance through the marketplace, they're probably referring to the Obamacare or the ACA or get covered. Okay, that's what all that means. It's all synonymous. They all mean the same damn thing, right? And on the left side, you can only buy these ACA plans during open enrollment, which typically is to November 1st through December 15th. It's typically like a 45-day window every year. Unless you got a job or you lost group health insurance within 60 days, you can get a ACA plan any time of the year. On the right side, it's just called major medical group health insurance. And you can buy these plans any time of the year, as long as you don't have any major pre-existing conditions. And by major pre-existing conditions, I'm talking about like diabetes type 2, heart disease, stroke, cancer, also diabetes type 1. If you have any pending surgeries that's coming up next month, stop, you're not qualified to buy any of these health insurance plans on the right side. But on the left side, you can. So let me scroll down a little bit. There's 5 different benefits between the left side and the right side. On the left side, you get free preventative. Same thing here on the right side. I have double quotes here signifying the same thing that I typed up here on the left side. So it's free preventative, like free blood work, cholesterol screening, colonoscopies. As long as you don't have a history of hypertension, which is high blood pressure, a history of high cholesterol or colorectal cancer. As long as you don't have anything going on, you can get all that stuff that I just mentioned for free. And as long as you're in the network as well. Number 2, left side covers maternity. Same thing with on the right side. You're a dude, you don't have that issue. Left side covers mental health, like depression, anxiety, ADHD, marital therapy, that sort. Right side can cover it too as well. Left side covers prescriptions. Are you on any prescription medications at this point in your life?
No.
God bless you. Okay, good. The right side also covers medications. Covers medications between tier 1, tier 2, tier 3, but not tier 4. I'll explain that later. But you don't take any medications. Just understand that tier 1 is generic, tier 2 is brand, tier 3 is non-preferred brand, and tier 4 is like $2,000 a pill type of specialty drugs. They're different tiers on that. But the left side does cover pre-existing conditions. So if you had a history of like heart disease, stroke, cancer, and you have a pending heart transplant coming up in like 3 months, you can buy an ACA plan. You're not going to get qualified. But on the right side, it does not cover any pre-existing conditions. So you got to be healthy on the right side. And because if it all checks out and you're healthy enough, then it's going to be affordable. Actually, I'm going to say more affordable than the left side. So the left side is actually expensive if you're like a middle income earner and above. All right. So you're 22 years of age. What would you say you gross annually?
My annual? Say that again?
Yeah, your annual gross income. What would you say you gross before taxes are taken out?
Well, this year kind of switched payments. Now salary. Last year was hourly, and that was at like 20-something thousand, but now it's 45.
Okay, that's a good increase. So yeah, you should be able to get some sort of a discount or a subsidy. But typically, if your income was like around 55 or 65, you're not going to get any discount. And therefore, this Obamacare market, also known as the Affordable Care Act, it's going to be expensive, which is why some people criticize it. All right. On the right side, it is going to be more affordable. Now, if you are the type of person that has a lot of pre-existing conditions or want to have kids, like if you're a woman, or at a lower income, like if your income was less than maybe 30,000 for a 22-year-old, then the ACA market might be more appropriate for you because you'll get a huge subsidy per month. But if you just need health insurance for just in case crap happens and you travel a lot and you want to make sure you have access to the very best doctors and hospitals, then the right side might be a better fit. Okay, but we'll figure it out as this Zoom call progresses. And the last point that I want to make is that the Obamacare on the left side is typically a smaller in-state network access of doctors and hospitals and smaller nationwide access of doctors and hospitals. But on the right side, it's a larger network access of the very best doctors and hospitals. Okay, questions between the dark side of the forest and the bright side here? All right. I'm gonna take a screenshot of this sucker and I'll email it to you later. But I just want you to understand conceptually like the main difference between the left side and the right side. And then now I am going to scroll down to this spreadsheet. It's a table, it's a side-by-side comparison. I'm gonna go over like the least suckiest Obamacare plan for you and the least suckiest Workers Association group health insurance market for you. We're gonna go over the name of the network, the premium, is it nationwide coverage, is it large in-state, the length of the term, enrollment fee, form of payment accepted, maximum benefits, the amount they'll pay, what type of like financial exposure are going to be if an accident happened or major illness diagnosis where it happened to you. So those are like all the big stuff, like accidents and major illnesses, where you go over the financial exposure. And then on the second half of this basketball game, I'm just going to go over like the small things in life, like doctor visits and labs and prescriptions. We're going to go over like your wellness visits, diagnostic specialist visit, urgent care scenarios. I'm going to go over how much it would cost if we got like blood work, x-rays, CT scans, PET scans, MRIs, or MRAs. And we're going to see if your doctor's in the network, that sort of stuff. Okay, can you follow?
Yeah.
All right, you live in Illinois, right?
Yeah.
So you got to go to Get Covered Illinois, not healthcare.gov. And what's the zip code that you file your taxes in or where you reside? What's your exact date of birth? You smoke tobacco?
No.
Your premium should be a little bit cheaper, but if you did smoke tobacco, it would be more expensive. And then typically household income, you file your taxes on your own, right? Nobody claims you
Yeah.
as a dependent. And then you said for 2026, your prediction is going to be about 45K gross.
Yeah.
So browse plans, if you Get Covered Illinois website and you plug and chug your info.
Just to make sure 2020. Okay, yeah, never mind. Yeah, you're right. Never mind.
Yeah, you're in Kane County, and then date of birth,
Yeah.
and on tobacco. Okay, cool. And then 45K gross. For now, I'm just gonna quote you on the left side, like the Obamacare options. And based on 45K, you're gonna get $65 off per month. And
Okay.
if you were making like 32,000, you would have gotten like $244 off a month.
Oh, wow.
Okay. So the more money you make, the less of a subsidy that you will get. But you have to be
Yeah.
accurate as possible because the IRS can still punch it down 2 years later and give you a document that says, hey, remember that 1 year in 2026 when you disclosed to Get Covered Illinois that you were making about 32,000? It turns out that after your tax returns, you actually made about 45K. So whatever the difference is from the 200 subsidy to the 65, let's say it's like the $200 difference, they could ask for that money back. So it is in your best interest to just be straight up and be upfront that
Yeah.
your predicted gross income for 2026 is going to be around 45. Okay. So again, this is Get Covered Illinois. Look at the cheapest plan. It's going to be $229 a month. Okay. These are all the health insurance companies that are offering you options from Ambetter to Blue Cross to Cigna, Molina, Oscar, United Healthcare. I represent them all. Okay. I think they all suck. The one that sucks the least is the one that offers a PPO. And out of all of these health insurance carriers, you're going to observe that the only health insurance company in the state of Illinois that offers PPOs is going to be Blue Cross Blue Shield, Blue Cross Blue Shield. That's all you see. So do you know what that's telling you? That's telling you that Blue Cross Blue Shield has the most money in their piggy bank to be able to pay for medical claims if they're the only health insurance company in Illinois that can offer PPOs. Because remember, PPOs grant you the very best access of providers. And by providers, I'm talking about like a doctor, a specialist, a lab facility, a surgeon, hospital. So you're going to see that the cheapest PPO is like $404 a month with an $8,600 deductible. So if you were my cousin and I knew all your background, I'd be telling you, okay, because you travel a lot, this might be your best, the least suckiest option for you. It's a Blue Choice preferred PPO plan, and it's going to be like $404.26 a month instead of $65 more. So what's 404 plus 65? It's going to be around like $469. But again, you're disclosing that you're making about 60 or 45K a year. So you're not going to be paying the $469 a month. You're going to be paying the 404. The name of this carrier is going to be Blue Cross Blue Shield Unlimited. Is it nationwide? Yes. These plans right here are also nationwide, but bigger. Is it the largest state network? Sure. You'll have access to about like 55 hospitals, plus Northwestern, but not Rush, nor University of Chicago. Those are the big three. I don't know if you're familiar with it, but in the Chicagoland area, top three hospitals, they're going to be like Northwestern, University of Chicago, and Rush. Whereas this one is, yes, a little bit better because you'll have access to about like 61 hospitals, plus Northwestern, plus Rush, but still not University of Chicago. Okay. So if shit happens to you, you get in a car accident and you want the best of the best, like surgeons, try to go to Northwestern and Rush. Okay. And the price tag for this one, I don't know yet. But for now, I'm just going to go over like all of these options. 404 is your least stockiest option in the Obamacare market. The length of the term is going to be about 12 months long and renews automatically. Same thing with the right side. Okay. So let's say you buy the Blue Cross Blue Shield plan for like $400 in March. Come November time, you're going to get like a letter in the mail or via email saying, hey, Diego, open enrollment's here. Your 2027 renewal rate is not going to be $404 anymore. It's going to be actually $465. So it's your responsibility to reach out to me and just be like, yo, or send me a text message saying, hey, can we shop something else? Because it went up like $65 and I can't afford it. If you don't reach out to me, it's going to automatically renew at that $465 rate because you're a year older. Remember, premiums are based on your age and your zip code. Those are the primary factors. And the older you are, the more expensive health insurance is going to be. Enrollment fee is $0.
Okay.
Same thing with the plan on the right side. There are health insurance companies out there where there's like a $50 enrollment fee, but not these two options that I'm going to show you this morning. Formula payment accepted, checking preferred. Do you have a credit card where you get like cashback, mileage, points, rewards, system like that?
No. I have a credit card, but
Okay.
I need to get through more with my bank.
Okay, it's all good. But I'm just letting you know that the plans on the right side, it's credit card and checking accepted. Some people like the credit cards on file
Okay.
because they get like points and mileage cash back, like 2% cash back. So if they spend like $10,000 a year on their credit card, they'll get $200 back. That's a win for them. Maximum benefits. This is the amount of money that a health insurance company will pay you. This is going to be unlimited. So you can rack up like $5 million if you want. Back in the day, around 2013 and before, it used to be capped at around $2 million per year. But these days, it's unlimited. And that goes the same for this workers' association column. So if an accident were to happen to you and you had this $404 plan, and let's say you fell off the roof, you broke your back, and it's like $100,000, you got to pay, you're going to be responsible pretty much for the first $8,600. Do you have that much money in your savings account? But if you did, out of that $100,000, as long as you pay for the first $8,600, that's when this health insurance plan will start covering the medical bills. So if you go to the emergency room, because again, you fell off the roof, they're going to pay 50% of whatever the balance is, because it says 50% after your deductible, until you reach your out-of-pocket max of $10,600. Okay. Do you understand what deductibles and out-of-pocket max means?
Deductible is what I first, and then out of pocket. I don't know deductible though.
Our connection is kind of bad. Are you able to like open a window maybe?
Yeah. I said I do know what the deductible does. I just didn't know what the other thing was.
Okay. So what is your biggest fear when it comes to health insurance? Is it getting cancer, a car accident, or just let's say a colonoscopy, something smaller than that?
Is there something I should be worried about? I don't really know.
It's just a conceptual question that I ask people because people buy health insurance to pay for big stuff like cancers, car accidents, colonoscopies. Cancer can be like $1 million and up. Car accident can be $100,000 and up. Anyways, there's three financial exposures. There's your deductible, which is the first line of like exposure. Then there's coinsurance. Some people get confused with coinsurance with copay. Copay is just like a fee, like a $50 fee or a $100 fee. It's a nominal amount that you have to pay just to talk to a doctor. Coinsurance is just another fancy word for like a second deductible. Because the plan I'm showing you has an $8,600 deductible. The total out-of-pocket max showing is $10,600. So sometimes shoppers get confused. Sometimes they're like, okay, what is my real financial exposure? Is it like 8,600 or is it like 10,600? Well, if you fall off a roof and it's 100 grand worth of medical bills, you're exposed for the first 8,600, but then the insurance pays 50% of it until you reach your 10,600. Typically, group health insurance plans offer like an 80/20, a 70/30, or like a 90/10 type of a co-insurance setup. But this particular Obamacare plan that I'm showing you is 50/50. So that means that once you pay for the first 8,600, the insurance starts paying 50% of the bills, but you still need to pay 50% of the medical bills until you reach the co-insurance max. And the co-insurance max is going to be the difference between 10,600 and 8,600. So the co-insurance max is going to be $2,000. Pretend this is like high school algebra. Deductible plus co-insurance equates to the total out-of-pocket max. So what I'm trying to say is 8,600 plus 2,000 equals 10,600. You follow?
Yeah.
All right. So if a plan had a $5,000 deductible, but it was like 100% co-insurance, that means that once you reach your $5,000 deductible, everything is covered at 100%. Therefore, the only total out-of-pocket max is going to be a $5,000 out-of-pocket max.
Okay.
That means to say is that once you reach the $5,000, the insurance pays 80% of the bills, but you still need to pay 20% of the medical bills until you reach the co-insurance max, which is going to be, let's say in this scenario, still 10,600.
Say that again, sir.
10,600 minus $5,000 deductible, that's going to be 5,600. So the co-insurance max in this scenario is going to be 5,600, right? So 5,000 plus 5,600 equals 10,600. Once you reach the $5,000 deductible, that's cool, but you're not free and clear just yet. The insurance will pay 80% of the bills, but your ass still needs to pay 20% of it all until you reach the 5,600. So this 80/20 is better than this 50/50. This 100% is the best out of these three scenarios. But this Blue Cross Blue Shield plan that I'm showing you happens to be a 50/50 co-insurance. So that's not really attractive to some people. But for the sake of simplicity, I'm just going to let you know that's an $8,600 deductible. Then 50/50 co-insurance, the $10,600 max out of pocket. Same thing with major illnesses. Major illnesses like a heart attack, stroke, cancer. So when it comes to the big things in life, if crap happens to you, like accidents or major illnesses, you're going to be pissy because 10,600 is a lot of money. But if you get diagnosed with cancer and it's like $2 million, you just paying the 10,600 is a little bit better than having to pay the $2 million. That's what health insurance is for. It's meant to protect you for the big stuff. So the small things in life, I'm referring to our doctor visits, labs, and prescriptions. As mentioned earlier in this call, preventative wellness, there's three different kinds of doctor visits. There's the annual checkup scenarios. There's the diagnostic situations where you go see a specialist like a dermatologist and you have lichen sclerosis. That's a diagnostic scenario. That dermatologist just diagnosed you with. The third scenario is where you just can't stop throwing up. So you have a super high fever, or you got hit in the face with a pickleball and you have to go to the urgent care room. But actually getting hit in the eyeballs with a pickleball is going to hurt. You might want to go to the ER. But I'm saying, like, if you twisted your ankle, go to the urgent care room. All right. Those are three different doctor scenarios. And then with this plan right here, as you can see, like preventative wellness, it says no charge. That's for preventative. So that's good. It's free. But then if you're going to see a specialist, it's going to be 50% covered. If you want to see a doctor because you got the flu, it's 50% covered. It sounds attractive, but that's after you reach your, and the deductible is a high ass $8,600. So that's going to really tick people off, right? There's no copays at all, like $25 or $35 copay. So you're subject to everything. So it's going to be subject to your $8,600 deductible first. Urgent care scenario, if I scroll down here, urgent care is also 50% covered after you reach your deductible 8,600. That's going to suck. So I don't know if you're aware of those, but if you didn't have health insurance and you wanted to see a primary care physician, a PCP is going to range anywhere from like $200 to $400. Okay. Specialist is a medical student that went to medical school even longer, and they're going to charge anywhere from $300 to maybe $900 just to talk to them. So you're going to be subject to that. But as long as you have health insurance, you will get network discounts that range anywhere from 20 to 40% off. That's what that charge that the specialist or that PCP charges you. And then being in the urgent care room, just so you're aware, being in the urgent care room can be about $500 and up. Being in the emergency room can be $6,000 and up, based on my medical records, based on my medical claims as a family man on my own. But yeah, lab cost. I mean, a CT scan can be about $2,500. X-rays could be about $200, $300. The insurance will pay 60%, but you pay 40%. But that's after you reach your deductible. So that's really not too attractive. Across down the line, I'm just going to say subject to 8,600, subject to 8,600. All right. Now I'm going to show you an option in the non-ACA route here.
Have I seen a specialist?
Yeah. You don't see a specialist every quarter for anything?
No, I haven't been to a doctor in a couple of years.
Okay. Good problem. Do you have a typical budget in mind per month that you want to not go over, like nothing over 300?
I mean, yeah, anything cheap right now. This is like the beginning of the salary. So I'm still kind of making my nest egg and trying to figure it out. But I just know that I've hurt myself a couple times with this job the last couple of years, and I never had any insurance, so I always had to pay it out of pocket. It was always like a hand injury or something, but I don't know. I just know if I'm probably gonna hurt myself again sometime.
Man,
And I just feel like I need to get it sooner than later.
I'm going to show you this option right here.
Yeah.
This one's going to be about $267 a month. The name of the carrier is going to be, the name of the health insurance is going to be Benefit Health Plans Incorporated. Again, this is the Workers Association group plan. So that means that you're going to be hired from an employer. Okay, you're going to be a W-2. You're going to be a research associate. There are data research companies out there, and this is just one of them. It's called LifeX Research Corp. Again, they're looking for healthy professional associates, and they're outsourcing their health insurance component to BHPI, which is a third-party administrator. So if you have questions about medical claims and premiums, this is really who to call. And then they email you through KMD services. So LifeX outsources to KMD. So what your job is, like every month, you're mandated, because this is a job position, you're mandated to complete a monthly assessment or a survey, most likely an assessment. And you'll get paid $40 per hour if you do an hour's worth of work per month. But the minimum is 15 minutes. So if you do a minimum 15 minutes, that's going to be $10. And as long as you keep doing this every month, they can offer you a group health insurance plan that is $267 a month. And instead of an $8,600 deductible, it can be a $1,500 deductible. Okay. The name of this carrier portion, insurance carrier, is again BHPI, which stands for Benefit Health Plan Incorporated. And the name of the network is going to be PHCS PPO. So it's going to be the multi-plan, stands for Private Healthcare Systems PPO. $267 a month, $1,500 deductible, free preventative. And then if you, let's look at the brochure here. If you got to see a doctor or a specialist, it's a $50 copay. You're capped at 10 visits per year. So I hope you don't go over 10 doctor visits, because this is a VL 1500. VL stands for visit limitation. So you're capped at 10 visits. You can only see the primary care and the specialist and the urgent care center at most 10 times per year. If you see the PCP 5 times and the specialist 3 times, well, the most you can go to the urgent care is 2 times. And if you have to go for 11th time, you're not going to be a happy camper because you're going to be subject to whatever they charge you. Okay. So it's a $50 copay, but that is after. See where it says after your deductible, and your deductible is $1,500.
Okay.
So the deductible is $1,500. $1,500 still sucks, still a lot of money, but it is less than $8,600. $1,500. So same thing with the urgent care, same with the labs. There's copays for that, but I will have to put you on hold here. I need like 2 minutes. I'm at the gym right now. My charger.
No worries. You're
Do
all
something.
good. Max. What's up, Max?
Charge.
Okay.
Still there?
Yeah, I am. All good. No worries.
Hopefully you were able to multitask.
Oh, yeah.
All right. All right. Do you have questions so far?
Nothing so far.
So let's go back to this. Deductible is just half of the equation. Remember, there's out of pockets, co-insurances. So once you reach your $1,500 deductible, then you can just pay $50 every time when they go see a doctor. If you got a boo-boo or a flu, or if you want to see a specialist like a cardiologist, podiatrist, dermatologist, any doctor that ends in an IST is a specialist. And in urgent care, it's about like $500. You don't pay $500. You pay $50 copay just to talk to the urgent care doctor. But if that doctor in the urgent care room says, "Oh my gosh, you fell off a roof," there you go. You should go get like a CT scan, a CAT scan, a PET scan, whatever scan, an MRI. You should get blood work, labs, whatever have you. You will be subject to these copays, not co-insurance, but specifically copays. That sounds good and all, but again, that's after you reach your deductible of $1,500. You follow?
Yeah. I
Follow.
still pay the $1,500 regardless, and then after the deductible, I'd still pay the 50 or the 200, depending on whatever I would need.
Sorry, my 6-year-old just started talking to me about her tooth.
Oh, no worries.
What did you say?
I was just saying, I got nephews and nieces at home. I get it. So after I pay the 1,500, and that's all right. When I pay the 1,500, would that just be at the beginning of the insurance? When I get it, I just give them $1,500, and then after that, I would pay those co-pays if I need to go see the doctor.
Correct. But just so you
Okay.
understand, along your journey of reaching that $1,500 deductible, you will get network discounts that range anywhere from 20 to 40% discount, as long as you stay in the network. And when I say in the
Okay.
network, as long as you go to providers that accept the multi-plan PHCS PPO. And I'm going to show you how that works and how to make sure certain doctors and providers are in the PHCS PPO network. There's this step right here that I can just copy and paste, send it an email over to you. That's after this Zoom call. Remember, let's say you need a liver transplant and it's like $1.6 million. You're not just going to pay $1,500 and then they pay the other $1.6 million. Once you reach the $1,500 deductible, you pay the copays until you reach the maximum out of pocket of $10,600. So it's really $10,600 the most you will pay if something really, really catastrophic happens to you.
Okay.
So the left side is 10,600 max out of pocket. The right side is 10,600 max out of pocket. Okay.
Okay.
There are smaller max out of pockets that could be like 3,000, but that's going to be more expensive than 267 a month. It could be like 500 a month. I don't want to go that far. Your income is only at 45K a year for now, but when your income gets better in years later, then we can maybe beef it up in the second, third, and fourth year. Okay. But for now, this is not going to make you go bankrupt if crap happens.
Okay.
So I talk about this section right here. Telemedicine, it's like FaceTiming or phoning a family member that is a doctor. It's unlimited, zero copay. So you don't have to reach your deductible of $1,500. So if you want to talk to a nurse practitioner or a licensed board physician, you pay nothing for their advice.
Okay.
Emergency room services. Okay, again, this is a visit limitation, 1,500. Is that there's limitations. You can only go to the ER like 4 times a year.
Okay.
So if you go to the emergency room more than 4 times in a given calendar year, this is not the right plan for you. I got to show you those expensive Obamacare plans
Okay.
because there's no limitations for that. This particular plan, it's got limitations. The reason why it's $267 a month is because you are capped at 2 accident visits and you are capped at 2 sickness related visits, like a stroke, a heart attack, accident, like a car accident, or again, you get hit in the eyeball with a pickleball, or you twist your ankle from basketball, whatever. So once you reach your $1,500 deductible, then you just pay $500. And just remember, an emergency room visit can be around $6,000. You don't pay that. You pay $500 copay, but that's after you reach your $1,500 deductible. So 1,500 plus 500 would be like $2,000 if that's the first claim that you file. And then diagnostic testing, advanced imaging, that's referring to like the MRI, MRA, CT, PET. CT scan can be like $2,500. I'm gonna say here that it's a $200 copay after you reach your $1,500 deductible. And then an X-ray can be about like $100 to $200, depending on where you go. You're capped at 3 X-ray visits per year. Once you reach your $1,500 deductible, you just pay $50. Okay.
Okay.
So you're gonna be pissy for the first $1,500. $50 copay after the $100 deductible. And then blood work, labs, you're capped at 3 of those per year. That's going to be a $25 copay. So if you go get an annual checkup, and then your PCP says, okay, Diego, you should go get like lipid panel testing. You should go get an H1 or some type of A1C testing for diabetes. I mean, it's not going to be free if they suspect that you already have that going on. If you already have a pre-existing condition of all that stuff going on, you're going to be subject to your deductible. But once you reach the $1,500 deductible, $25 copay after your $1,500 deductible.
So with my monthly fee, that's not going towards the deductible at all.
That is why some people think health insurance is a scam. You're just donating $267 every month. If nothing happens to you in a given calendar year, you just donated $267 to the Health Insurance Society. 267 times 12, you're just going to donate $3,000 if nothing happens to you. So you're just paying $3,000 for peace of mind, knowing that if shit happens to you, you'll be covered. But if shit does happen to you, like a car accident, you fall off a roof, well, it's not going to be all covered 100%. You still have to reach your $1,500 deductible. But make sure you have at least $1,500 in your savings account. And then once you reach that $1,500, that's when the insurance starts paying. And you start to pay like these copays. So based on your background, this column right here might be the least suckiest option for you compared to the Obamacare plans. I typically ask folks, do you have any preferred doctor or PCP or specialist that you want to go see? All right. So let me circle back because I'm pretty much done here. Again, most people are concerned about these 3 factors: low deductible, low premium, large network access. Low deductible, yes, it could be a lower deductible at $1,500 versus $8,600 with this option. And then low premium, yes, this $267 is definitely lower than the $404. And you don't have to worry about disclosing what your estimated income is going to be for this year. You're only dealing with one entity on the Workers Association column. With the Obamacare market, you're dealing with 2 entities. You're dealing with the IRS, and then you're dealing with the health insurance company, which is Blue Cross PPO. Sometimes they're not on the same accord. Larger network, this is imperative. It's kind of pointless to be spending $400 a month, and then let's say you get hit by a taxi cab, you're downtown Chicago, and the ambulance sends you to Rush or University of Chicago, which is not in the network. And to resuscitate you and to heal you, bring you back to life, and it's $75K, you could be subject to usual and customary standards, which just means that you could be subject to $75K, whatever they charge you. And that's not going to make you a happy citizen, especially if you're paying $400 a month and then you got $75,000 with medical bills still to be left paid for. That's why people think that health insurance can be a scam. That's why I spend an average about an hour on a Zoom call like this, visually explaining to you what is going to be your exposure. Need more dental. I still didn't get time for dental just quite yet. Last time, 3 years ago was the last visit. But for now, what are your thoughts on these price ranges between 404 and 267? Are you leaning more towards the left or the right?
Definitely more towards the right. And to be really honest, I just got my first paycheck today, and that went all towards debt and bills. So I don't have the 1,500, but I can definitely get it in the next 2 weeks for sure. Yeah, I didn't think it was going to be all this, to be honest. But I still need to get it because I do hurt myself almost every summer. The right is definitely more towards my field.
And then just for shits and giggles, I'm going to show you how much dental can run.
Okay.
Have you spoken to Greg about like if he's going to help out? I'm not too clear on that scenario since you're working with him.
He said that he helped start, I don't know, start it. I can't remember what exactly. I don't think he's going to help like pay fully into it, but I think he's just going to help pay starting it.
Okay, that's good. At least he's helping you pay some of it.
Yeah. Yeah. Dental is really mainly all I was worried about because I can take care of myself. I don't go to the doctor if I'm sick or anything. I take care of myself. It's just my teeth. Yeah.
Okay.
So that was my
So
main worry.
So dental ranges from $28 a month to as high as $48 a month.
Oh, wow. Okay.
So if you've got a basic filling or extraction that might need to happen, you're going to be exposed to a $100 deductible first. Not going to be
Okay.
hard. But this left-hand side is capped at $1,000 worth of benefits per year. This one's $2,000. Really, this type of plan is $28 a month. That's what we meant for like 18-year-olds and under. Are you 22? So you're a little older. You're a young adult. I would say either 39 or $48 might do the job. But if you're able to squeeze out $9 more per month, and you're getting financial help from your employer, I don't know what kind of filling or extraction it's going to cost you, but this can pay up to $2,000 per year. So you get more of a value just by paying $9 more per month, from 39 to 48.
Yeah, I could definitely swing that. No problem.
Right. And then major services are like surgical. I don't think you need surgery at this point.
Yeah.
Typically like root canals, bridge crowns. This stuff happens to like 55-year-olds and older. And there's a 12-month waiting period for implants. Again, not an issue really at your stage. I think you just need a filling or an extraction.
Yeah.
So yeah, I'm going to send you a screenshot of this.
Okay.
And were you looking for like an effective date of May 1st?
What does that mean? Sorry.
Like when were you considering having the health insurance start? Like May 1st?
Yeah, I can do that.
Okay, so I don't typically
Yeah, I
give
can definitely do that.
deadlines, but if you're more leaning towards the right side, that the one that's 267 a month, you just have to
Okay.
get to me before the 20th of this month of April. And then we could do another Zoom call just like this, and it'll take about 15 minutes to submit an application. And then on an application, you can ask for general information like your name, last name, where you live, some background on your education, and then about like 20 medical questions. Because the plan that you're attracted to, you have to qualify for it. You can't just buy it. You have to be super healthy. You can't have any pre-existing conditions whatsoever.
Okay.
Okay?
Yeah.
All right. Thank you so much. I hope you have a good grasp of like how like health insurance really works as a 22-year-old.
Yeah.
I'm gonna text you a screenshot of this side-by-side comparison. And then if you get back to me before April 20th, which is on a Monday, then I can make the effective date start as early as May 1st. But if you get to me on Tuesday, April 21st, then the soonest effective date is gonna be June 1st. So that means that you wouldn't have any coverage in May. You follow?
Okay. Yeah. I definitely should have it by the 20th then.
All right, cool. Well, thanks again.
Yeah.
I'll let you go. You got my personal cell. If you have any questions or concerns, just holler. Okay? But
Yes,
I'll
sir.
send you
Thank you.
screenshots of all this stuff. All right? Adios. Bye.
Adios.